detectors into very inexpensive pieces of paper and create almost an infinite number of tests for as many different detectors as we can attach to nanotubes, something to that effect, right? And it has the potential to completely redo how we detect almost any disease. It's only limited by the number of detectors that get developed in terms of binding agent, whatever word you want to use, okay, that we can attach. It's the only limitation on this. But it removes the need for mass extraction of blood. It removes the need for it to go off to Earth. It can be done anywhere in a mobile way, right? And so we graduated and we started a company, Drop Diagnostics, to pursue this vision. We came into DreamIt with some proof of technology that this could work. And we spent the last several months getting the technology to a point where we can launch clinical trials and focusing on which disease should we go after first. Okay? And then drive into flu. We've chosen to focus initially on flu. Why? Well, because it's a huge killer around the world. It historically has been. And it's something we can do something about the sooner we know something specific. The rapid flu tests on the market aren't specific enough, and the specific tests take too long. Yet we have all these therapies that treat flu. So if we could just learn about who actually has the flu soon enough, we can intervene, break the chain of transmission. Everybody does better. And it's a huge problem. So that's why we started there. Here's where we are so far. This is the technology. It's moving into this form factor. We know there's a long path ahead. This is what the path looks like. But through DreamIt, we've been figuring out what are all the pieces we need, aligning with partners who are going to help us get through each of these stages. And here's where we are today. Here's what we're going to be accomplishing in the next 6 months in order to get to market with this product as quickly as possible. And oh, by the way, we're opening up discussions with lots of other companies to use this platform and have them develop the assays and license our technology for other tests as well, so we can kind of parallelize how this gets out in the world, something to that effect.
Okay, so I understand that model lays out problem and solution kind of thing, but if for at least running through it sounds like there's a lack of a climax in a way, an excitement level to a degree. It's kind of a lot of smaller up and down feelings. I mean, it depends on how, I don't know, the demo day expectation, but some of the other slides or some of the presentations I've seen, it seems like kind of layout problem, build up expectation or excitement, and suddenly
to me the excitement is you now have a working prototype. Okay, you have data that proves that you can detect concentration related changes based on this detector. Okay, what's the pathway. You believe with confidence that you can get 510(k) approval. Okay, and that to get there you have to do trials, and you have already lined up the partners for those trials. So you know what needs to be done. You have all the supporting resources marshaled at your disposal. At this point, it's an exercise in getting it down into the form factor you need to create something that can go through the trials and do the trials. But you have every expectation those trials are going to be successful. But the chapters are, it's just a chapter in the journey, right? You're not done. What else are you going to say? This is what you've done. So all you can do is put it in the best possible light, which is we've removed a lot of the risk. Yes, it's still a long road ahead, but it's not a 5-year road. It's not even a 3-year road. In 6 months, we believe, or 9 months, we believe we can have 510(k) approval and be in the market because, the technology is working. We have the partners lined up. We know what the path is, and we're executing it.
For what it's worth, and I heard somebody typing, so hopefully you got it down, but I really like the way Elliot laid it out. I think we started that. I was going to ask Elliot where I read. I mean, I really did. I thought I could completely follow that, and so without re-summarizing it, if you were able to kind of capture that, I think that would be a good flow. Okay. Kind of telling me the general. Explaining to me at a very general level, then explaining to me why you guys, what your relationship is to it as well as each other. Yeah. And then the fact that you've come here and that you've got it. And one of the things I really like, so I want to make sure you guys don't miss it, is a lot of times we have companies that come in and say, we're starting here, but our vision is here. Like on the last slide there, that tagline you had, we're starting with the flu. What I liked about one of the transitions or one of the comments that Elliot made was, there are a lot of places we're going to be able to apply this. We're starting with the flu, so now you're also painting the concept that there's a lot of application for this. There's a big market, that there's a big thing you can do, but that you needed to start somewhere, so you're starting there, and that mean, that way the people aren't thinking, well, the flu, that's just, I mean, even though it's a big market per se, it's too small. It's like, no, we're doing, so we just happen to start here. And then, so here's what we did, here's the concept, we've been in Dream It, this is what we've accomplished, this is the progress we've made, this is where we're going. So I think if you're able to capture kind of what Elliot said, I do think it flows.
Now, for the ending of kind of the whole presentation, it does end in like a bit of an ask and like a setup, but this is something that David kind of wanted us to have as like a strong kind of like influential ending to a degree, and that's why he wanted to have us end with like all the potential tests we can do. Like we're starting with the flu, but then this is everything we can do, and like end with that thought in people's mind. So I thought like with the layout that you were having, it's like
you can still circle back to it, right? You can still circle back to like the flu is the start, right? Mm-hmm. There is no limit to the number of detectors and disease states that can be applied, it turned into instant tests using this technology. Okay, it's only limited by the discovery of biomarkers that are specific enough, right? That's the only real limitation. Yeah. You can't do it all, but you can start listing. Here are some examples, other examples. You can talk about things that you actively explored and put into phase 2, right? You can say some of these we're going to do, some of our partners are going to do. No matter what happens, we're going to get paid for all of it.
I have a suggestion for you in that regard. Could you, and I'm asking this question as a prelude to my suggestion, could you name 20 other things besides the flu?
Yeah.
Okay. So what you might consider doing is, again, in the way Elliot pitched it, he talked about the fact that you might bring in partners and license other people to do it, and those kind of things, right? So what you might consider doing is, towards the end, so you're talking about the progress you've made, right? And then you're talking about, you might talk to the fact that we're raising some capital to do, to do this and that. And part of it might be, and also to set up the infrastructure, I'm trying, so somewhere in here, did you talk at all, and I'm not even sure if you really talked to it, about what the business model looks like? Right, so the reason I say that, and I'm completely making up what I'm about to say because I don't know if it's the case, but I'm guessing based on this, that you might say, and as we move forward, there's two business models here. One is that we can produce, volumes of these things and sell them, right? I assume that's potential, like for the flu.
Yeah, the problem is that the piece is that their test has to get approved and reimbursement coverage is still way out.
Okay. But then you could say, and the other way to do it is that we can sign up partners who would license this technology to do all these other sort of tests. Yeah. And then you could say, and we need some capital, to not only continue with the technology, but to begin to put the sales and marketing infrastructure together, and that we think that, we could, that would lead us to be able to go after like all of these diseases. And you could literally put up a slide that looked like that, or even if there was some graphical way, like almost a logo to identify each of these, to kind of have a logo slide up, but instead of being companies, it being different diseases and so forth. But you might be able to segue into that when you talk about the partnerships, which is part of your business plan, which is part of what you need funding for, so instead of just ending and saying we're raising funding to do this and that, you could kind of say we're raising funding to do this, and also to begin to establish the relationships and partnerships so that we can kind of go after all of these type of diseases and, put a big slide on them. Just as a thought.
If you want to be a little provocative, you can even say, look, a lot of people talk a good game about being a platform, okay? But this truly is a platform. Like, we're developing these initial applications, but we're very open, in fact, plan to give others access to the base technology so that they can develop other applications as well. And that's truly the definition of a platform. Right? You're going to hear other people talk about, oh, we have a software, it's a platform, blah, blah, blah. But you really are a platform, as the word was intended to be used. So that's what this message is.
It's an end kind of platform.
Oh, I totally agree that, like, the problem with most companies in the diagnostic space is like one day maybe they get a reimbursement code and they get paid. You know what? What happens if your flu detector doesn't even work out? Who cares if you've got all these licensing streams coming from 20 other diagnostics companies who are all working on versions of their test for you, right? You have to raise less money, there's less risk. You know, maybe that becomes the ultimate business model. You just are, you know, licensing the technology out. You never develop a test on your own, ever. Until one of those guys decides to buy the base technology because that makes more sense to them. So I do think it's worth describing the business model a bit. That, you know, especially because that's what they say, you know, it's so long before we'll ever see revenue. Maybe not, right? If it's truly as much of a miracle detector as you say it is, there may be revenue, short-term revenue out there. If you can convince people that it really works.
Yeah, I mean, from my research, into the field, like carbon nanotubes, it seems like these large companies are trying to snatch up carbon nanotube IP as soon as they can. So I think there's a lot of potential there.
Right. Okay. Comfortable with the flow?
Yeah.
Let's rearrange the slides and let's just look at them this afternoon before you break for the night.
Yeah.
Okay. Just to get it in the right order and that you're comfortable with what's going to go in. Then you can work on improving what you're going to say. And then we can work on improving how it looks.
Yeah.
Because
That
it's
works.
a little, some of it's a little cheesy. But that's the least of your worries.
Stories are important.
This is truly like there should be like a eureka moment part of the story.
So that's why I like the way Bookspan kind of had us directing set it up. So it's like we talk broadly about how we have this sensor and technology, and then there's this problem.
Nobody, you got to anchor them first, which is what I agree with
Okay.
Mike, which is they don't even know what you're talking about yet.
Yeah.
You're up there saying, hey, and you don't even think the way you tell the story you're going to need a picture slide of the three of you.
Mhm.
It's just my two co-founders and I, you know, we've been working in labs with, you know, cutting edge materials like carbon nanotubes for the last several years, and we've developed a lot of expertise. And along the way, we had a big aha moment that there's an opportunity here to completely disrupt, I hate using it, completely change how diagnostics are done, and then go from there. There's lots of applications. We got to pick one to start.
Fair.
Good.